There's one provider who literally called me while he was on a Disney cruise. He was so sick of running his practice and he's like, can you just help me? I'm like so close to bankruptcy. He was having so much difficulty running his practice for 10 years by himself. I talked to him for a little bit. I'm like, let me take a look at this. Let's see what we can do. And so I ran over to Universal Studios to meet him. We discussed it. We handshook on the deal, and 1 week later we signed the purchase agreement, and we were all like, let's just do this. Last July was his highest revenue month he's ever had in his entire career.
So tell us a little bit about what got you into neuroradiology in the first place, or like your background in that field.
Sure. I'm an Indian kid. So it's doctor or bust. So my dad wanted me to go to med school. That was, the large motivating factor. I questioned it a few times, but decided, okay, let's go into medicine. I'm the youngest out of all the cousins on my dad's side, and my grandfather had a dream of one of his kids being a doctor, but my dad chose to come to America instead of becoming a doctor. He actually got accepted into med school in India, so kind of carried forward. And being the youngest, I was kind of like the last hope to become an MD. My sister's a dentist, but MD dentist is a thing. Until they learned that my sister does very well, being a DDS, and has a pretty good life herself. But yeah, so I went to med school largely because of that, I would say. But I always had a longing to be entrepreneurial. But yeah, so essentially neuroradiology, I always had an interest in neuro. It just kind of fits my brain, if you will. I'm very systematic. And I wanted to do neurosurgery. I did about 3 months of neurosurgery rotations, and at the end of that, I'm like, what am I doing? I'm waking up at 5 a.m., going to sleep at 9 as a student. The residents are there longer. And all of them are like, I wish I was a radiologist. I'm like, brilliant idea. So I just tore up the application and I applied to radiology without really knowing what radiology was going to be like. And then ultimately I ended up in neuroradiology for fellowship, and it was good. It fit my personality, I would say. To some extent, I do long for the human interaction, which you kind of miss. And I was working overnights for 10 years, being a neuroradiologist, and that's tough. It kind of pulls the creativity out of you after reading 100,000 brains.
Yeah.
and so I always had businesses on the side for that reason, just because I needed something a little more stimulating.
It's amazing. So, I would love to hear more about that side of your journey as well. So there's the medical side, but side businesses, like what did that entail, and what have you learned from doing side businesses?
From those businesses, I probably picked at least 2 or 3 things up from everything I did in the past, whether it was the commercial real estate, the landscape company, or dumpster company, whether I learned about things related to partnership or employees or accounting, how to use QuickBooks, which payroll service to use, insurance things. So I learned little tidbits from every single one of these experiences, not all successful, but ultimately, I think those things accumulated to help me be more successful in my current role.
That's awesome. And you originally started with your wife, Modern Foot and Ankle, and then later rebranded to Evolve. Can you tell us a little bit about that story and how you started and how you've become to evolve and do Evolve?
Yeah, sure. Modern Foot and Ankle started actually as one office in Tampa. My wife's co-resident started that. He had difficulty getting on insurances. And so he ended up partnering with her other co-resident, who was also in Tampa. And he had to kind of convince everyone to join forces. So January 1, 2021, we combined 4 offices in Orlando and Tampa, all between the 3 co-residents, which is kind of interesting because we joked around during residency even of opening a super group. And then everyone went their own ways. But we all picked up experiences from every one of those. So the original partner that started Modern Foot and Ankle, he's our CRO now. And he learned everything billing because of his experience in Chicago for a year as an associate. And then coming down and opening up his own, he learned everything about how to get onto contracts and such. So that was kind of the origin of Modern Foot and Ankle. And fast forward 3-4 years when we all figured out what seat was right for each one of us. And we scaled substantially from approximately 4 offices to 40 offices in 4 years. We decided, okay, we might want a little bit more. Let's add ancillaries now. And so I was talking to several PE groups, and they're like, hey, vascular is great. Hey, surgery centers are fantastic. And these things have great margins, et cetera. And so we started to interview vascular surgeons. And a lot of them are like, I don't want to be called foot and ankle. They're like, what if I want to treat carotids or aortas or anything else above the ankle? So ultimately, we're like, we need to rebrand. And so Evolve Health is the brainchild of my wife and kids in a car. And so it was a family affair. And we're like, what are we going to call this thing? And I can't say, I probably won't say what my daughter's suggestion was, because it's one of our competitors. but she was like really stuck on it. But then everyone fell in love with Evolve, and Evolve just makes sense. It's organic for us. So Modern Foot and Ankle was right at the beginning. It was the right fit for us. We were really modern, for sure, in comparison to the typical podiatry practice, frequently seen as a carpeted place, nail dust everywhere, old drill bits. So we really refreshed that, and all of our offices kind of speak to that as well. But for me, it's important to never get dated. And so Evolve just made sense from that perspective, because all we do is try to get better. We're not going to be perfect at anything. We get that, but we're going to strive for it over and over and over. And so that's why we decided to go with Evolve Health.
Love that. Family decision.
Yeah.
And matches exactly what you said personality-wise. That's great.
Yeah.
So from a motto standpoint, the motto is this. So the motto of actually Evolve is big city technology, small town care.
Yep.
What's the story behind the motto?
So came from Modern Foot and Ankle at the same time. So we loved that motto from the beginning. It's been carried with us. That's the piece that remains from Modern Foot and Ankle. And we toyed with the idea of changing it up, to something more evolved, but it just didn't make sense. And it just resonates with so many people, because frequently you think of things that are tech forward as not as welcoming. And so we like to show our updated spaces or our latest equipment, our vacuum assisted Dremels, whatever it may be, as pulls for people to come to us. But at the same token, we want them to know that we're still going to provide good care, good quality care. Our providers, they understand that that's first and foremost. And so it's just really relevant for our patient base, but it's also relevant for our providers. It's also relevant for our staff members. We really just try to stay with the times.
What would you say is one of the challenges that your company faces, or obstacles that you've either had to have overcome or that you see coming as you continue to scale and grow in other specialties?
Since the beginning, we've had obstacles, right? Whether it's working out the kinks with partnership, or it's figuring out which vendors to select, or how to staff correctly, or building out every single department and position over the last 4 years. So I think I think we're used to challenges, and so our ability to adjust and improvise is very unique. In a practice of almost 40 docs, sometimes there are 40 stakeholders in certain practice environments. We're not that. There are 3 owners, all previous physicians. We're all full-time now, administration. We get it, and we realize the urgency of making things better for our providers, for our staff, for our patients as quickly as possible. So we love the fact that we have such few stakeholders within the organization, and our associates all trust us to make the right decisions for the company. So we're super agile. Like next week, I decide we want a new EMR, and they're like, all right, let's do it. Everyone's like, why next week? Why not this week? So everyone's just on board with change. It goes back to our name, I guess.
It's amazing.
Yeah.
Well, and complete opposite of how medicine usually moves, right? Like it's such a slow adopting field.
For sure.
So how do you breed a culture like that? Like how do you get your providers and again, you know, co-owners here to buy into that type of speed of iteration?
I think they got used to it over time. So I would be like, okay, we're going to slow down for a little bit. And then we'd go and buy 7 offices or sign 8 leases or hire 10 doctors. And we just did that over time. So people got used to it and they realized that's the company culture. I've been notoriously called a liar when I say we're going to pause and grow by my director of compliance, and she jokingly tells everyone, don't trust him if he says we're going to stop, because as soon as he's done fixing operations, we're going to run again. Yeah. And so just setting that precedent from the beginning has been helpful, and also we grow half of our managers and middle managers from the ground up. I have a medical assistant who I rely on very heavily for every single new office. He was a medical assistant 1.5 years ago, actually. And he is now my director of corporate development. And he got us 15 leases just this year. So he became a realtor for me. Over 2 weeks, he took a course and he became a realtor. And so that's kind of just, that's the culture that we have, that, hey, there's a lot of room for growth. The faster we grow, the faster you grow within the organization.
And you mentioned acquisitions versus opening new offices. As you think of effective strategies for growing and scaling the business, when have you decided to potentially acquire versus build new, and what are the benefits that you've seen in both?
Oh yeah, sure. Good question. So acquisitions versus de novos, that is something we didn't really toy with at the beginning. So we did only de novos because we were poor. And we were like, okay, how far can we stretch this tiny little credit line? And so we're like, the only way to do it is just to lease a space, buy the equipment, and wait. Luckily, that went really well as an experiment for us. And so we just led with that. We led with de novo offices from the beginning. Last year, we had 5 acquisitions of independent one provider offices, some of them strategic to get into Texas and get certain contracts, et cetera. And others, providers came to us asking for help in helping to manage their practice. There's one provider who literally called me while he was on a Disney cruise. And he was at sea, and we had an hour like conversation. Yeah, and it dropped 3 times. But he was so sick of running his practice, and he's like, "Can you just help me? I'm like so close to bankruptcy." And he actually tells everyone this too. And he was just asking for help because he was having so much difficulty running his practice for 10 years by himself. And so I talked to him for a little bit. I'm like, let me take a look at this. Let's see what we can do. And so I ran over to Universal Studios to meet him, and he's separated from his family for lunch real quick. We discussed it. We handshook on the deal. And 1 week later, we signed the purchase agreement, and we were all like, let's just do this. Wow. Last July was his highest revenue month he's ever had in his entire career. Wow. And he emailed me, which was like, super heartwarming for me, that he emailed me about it. And he's like, this is the best month I've ever had. Thank you, for the opportunity. So we took a lot of those acquisitions because of that, because people came to us. And there are pros and cons undoubtedly with acquisitions and de novos. Acquisitions are sort of tough because we make everyone change an EMR, we make them change billing, because standardization is really our value add. When we're standardized across the board, we could use the same call center, the same billing people, et cetera. And so, it's tough from a provider perspective to have to go through that. So that becomes a little more difficult. So de novos are really easy for us. And And the other thing is that we can always maintain company culture with de novos. So we lean more de novo in general. And it's an unusual space to be in because most folks are just putting a bunch of stuff together, but you get the culture of each one of those acquisitions. So we're very strategic about that.
It's amazing. So a couple questions then, because I love this story. How did this guy on the cruise, Disney cruise, like find out about you? How do you get the word out of what you guys are doing and why it's going so well? And secondly, once you did the handshake and started the business with him, what was the secret formula? Like how did you take 10 years of him not being able to be successful and turn it into his best month last July?
Yeah, I guess I'll go straight to the second question. So I think that was just a product of insurance contracts obviously matter with volume.
Sure.
But we have our processes very fine-tuned. A lot of folks think they need multiple medical assistants. They need, multiple front desk folks. So we keep it very slim. There's one person in the front. We call them practice coordinators because they control the flow of patient traffic within the building, and we realize that. And then we have a medical assistant in the back and a doctor, and that's it. And it's pretty bare bones, but it's because all of our processes are handled offsite. So we have an entire department of clinical facilitators, which handles surgery, benefits, eligibility, the call center, et cetera. We don't let the phone ring in our offices, which we get some flack for. So we're kind of like balancing back and forth between that right now. But yeah, so we have a lot of efficiencies with our scale now. And we're just, at the end of the day, because we had to be frugal at the beginning, we just learned to be cheap from the beginning and just like make every dollar stretch as far as we could. And I think that brought a ton of value to his practice in particular. When we just fine-tuned a couple of things here or there, we're like, don't worry about all these extra services, like do the core of what you're supposed to do. A lot of people just try to sell a bunch of services, get some fancy equipment. It's not needed to provide good care. It's, you want cutting edge technology that works. You want to deliver results to the patient. And he had a great reputation, so there was no problem with patient volume or anything like that. It was just a matter of monetizing each one of those. And so we look at eligibility and benefits, and we scrutinize that for every single one of our patients. And we try to give them the level of benefits they deserve based on how much they're paying for their insurance.
So you mentioned a lot of like technology, big city technology, and like the equipment that you use. Obviously, as a evolving, forward-thinking company, you're starting to implement other technology that's new in the space and stuff like that. What makes you most excited about technology that's starting to be developed, and how are you going to apply that into your practice?
Good question. I like the Evolve plug too. Yeah, so I think technology for us, AI is obviously a big part of it. And I think in particular, what we'll do is create tons of efficiency for us in the workplace to allow us to focus on the small town care again. Because a lot of our doctors are running behind from one patient to the next because they really do focus on the small town care. So for us, I think software is a place for especially podiatry or multiple specialties for us in the future. It will help reduce that burden, increase the efficiency, and help us keep operations lean in that regard. There isn't a ton of innovation in podiatry as we speak. There is surgically. There are always minimally invasive procedures. There's certain equipment that's pretty standardized that we use across the board. It's the latest tech, but it's really important for us to really, balance the technology and the care.
That's awesome. So question then from the patient side. I love the strategy, the business. I love the processes that you talked about, and then the technology as well. So how do you help the patients see that value, right? How do you help what you just described translate over into like a high quality patient experience that makes them want to go share their experience and have organic growth that way?
They see it as soon as they walk in the door. We choose like the same paint color in every office. And it's insane. They come into our offices and they're like, this is the cleanest doctor's office I've ever seen. I'm a nut about clutter. My countertop has to be clean at the end of each day. And so I actually send spring cleaning reminders via an email. I send an email to the whole company every Monday. And I send that at least every few months, and everyone's like on high alert that I might walk in and see the clutter, because that's the first thing a patient sees. And to be honest, once they see that, they kind of just welcome the rest of the experience, and then they see there's no paper, everything's on an iPad. I just go straight into the back, get my care, walk out with everything I need. We don't call patients back for procedures. We try to do them that day if we can. And our doctors are really, really good about that. And so we try to make it convenient for them. And I think the easiest way for us to track that, the metric, would be our Google business reviews. I don't know of any other competitor of ours that has as many sites as us and still holds a 4.9 star Google review, which is pretty wild when you see 1,000 organic reviews, 2,000 organic reviews, 500 for each one of these sites.
If you could change one thing about U.S. outpatient care to make it more effective, what would it be?
I wish it would be more seamless from one provider to the next. And I think a disparate system of different EMRs, different platforms, different communication pathways, I think it just creates a little bit of chaos in that process. So referrals take longer than they need to. A doctor doesn't know what they need to know when they're seeing that patient after they've been referred. So creating a seamless experience, I think, would drastically change healthcare in our nation, because I think everyone kind of works independently as a silo on a patient. And for that to carry over from one experience to the next would be very helpful. That's why with Evolve Health, we're focusing on comprehensive diabetic care for the most part, right? That's a large portion of our podiatry population. And so for them to be able to see the neurologist for their peripheral neuropathy, to see a physical therapist, to see wound care, to see nephrology if needed, all in one place with a seamless experience that's all integrated, really helps.
Yeah, it's amazing. I couldn't agree more. When I was practicing, I was trying to do exactly what you just described. It was hard to do, hard to build. But ultimately, it's the best scenario for the patient.
Yeah.
To your point, right? Like one place, congruent, consistent care, similar or familiar faces and team and admin support, and hopefully better outcomes.
Yeah.
Is the whole idea.
100%.
And so, talk to us about your why, right? So again, you have this amazing path of medicine and business and growing these practices. Your wife practices in your practice now. So what's the reason behind, like, what drives you to be involved in so many things and balance a family and so many practices? And again, having gone through med school and everything else, like what's your why and biggest driver?
I think what's interesting is my wife and I are both very similar. We're actually extremely logical and creative, which is kind of a weird breed, because you want to be like systematic and that makes you happy, but it's not enough. And then you got to create or innovate. And so I think that's one of the driving factors. And this is a space that we could really affect massive amounts of change if we do it right. Yeah. And so for the right-sided and left-sided brain people, I think it makes a lot of sense. And this is a space that I really do think is disjointed and can use some improvement. I think healthcare in America can drastically improve if the right person or the right team comes in to create a system that's just a little easier to navigate, I would say, for the patient. I think that's probably the biggest thing that bothers me. Like my parents trying to get a medical appointment. It's like it's impossible for them to navigate the system. And I feel that way sometimes. Yeah. So I would love to streamline that process in some way and kind of contribute to the healthcare industry in more ways than I could have as a neuroradiologist, I would say.
It's amazing. Well, we appreciate the discussion. Take us a pen or 8 to sit down and just walk us through your journey, your path, your interests, like the full circle of where you started, where where you're at now.
Yeah.
And appreciate you being willing to share a little bit of your time with us today.
Thanks. I appreciate the opportunity.